A new report released this week shows the number of people experiencing homelessness in Ontario is reaching a, quote, tipping point. A study conducted by the Association of Municipalities of Ontario reveals that more than 80,000 were living on the streets last year. The AMO says about half of those people, they've been homeless for at least half a year. It found there's also been a 25% increase of people living in shelters or on the streets compared to 2 years ago. The AMO says without significant intervention, homelessness, it could double in the next decade and reach nearly 300,000 people in the event of an economic downturn. And for more on this, we're joined by Dr. Andrew Boozary of the University Health Network. Dr. Boozary, I want to start with this. You know, the title of this report, Municipalities Under Pressure, the Human and Financial Cost of Ontario's Homelessness Crisis. What does that mean? Put that into words for us.
Right. I think what, this report has been really important in underscoring a lot of things we've already known, but there's a lot of compelling data that the AMO report has been able to unearth. One is, I think, the health impacts that we have to talk about, and we'll get to a little bit later. The fact that, as you mentioned, there are people that are now living for months that are unhoused. There's chronic homelessness, this idea that being without housing, being without safe basic necessities has become the norm. And the economic impact, I think that's a really important piece on this, that really we can't have a vibrant community, city, or province when you're looking at a staggering rate of people who are now unhoused. And I think the report also touches on the real risks of doing nothing or doing the same thing, that there'll be even more people that will be flowing into either shelters or having to sleep and live outside. And I think we've been really clear about there are real health consequences to that.
I want to talk to you more about that because you've been pretty vocal about this. You were quoted in Toronto Life as saying, quote, I've seen unhoused patients lose limbs.
These are the very real consequences of policy choices. That these are not individual failures, or I don't think anyone would want to lose a limb, to lose their own health and well-being. And these are the realities that have played out for people when you cannot access housing, you cannot access the healthcare system. And so for things that we can treat like diabetes, if people are not able to access housing, they end up losing limbs. And that's, to me, or ultimately dying. The other thing, Bakari, we have to be really clear about is that people who are chronically unhoused live half as long as the general public.
Okay, look, living in the GTHA, it's tough. People are working, some people work more than one job. A lot of people can't afford to feed their families. They're going to work each and every day. They're having to walk through the streets of downtown Toronto. Why should they stop? Why should they take a minute to look at someone who's on the streets when they're having a tough time themselves?
Well, I think that's what the report really gets at. The fact that we are dealing with a lot of people who are now at risk of becoming homeless, that are at risk of becoming, have precarious housing. I think the points that you're making, the cost of living crisis is very real. People are making impossible choices right now between groceries, between paying their rent, between renewing their medication. So the idea that there's this real sense of separation or this distance from becoming unhoused, I think is becoming much more imminent for people. And, we just heard these stories of people who were former politicians that are now and have been unhoused for a while. So these realities are not things that are really foreign now for thousands to, tens of thousands of people.
Okay, so look, it's always easy to point the finger, always easy to say, look, this is what the problem is, solving it, coming up with answers. That is not easy either, but that's something that you are working towards. There's a social medicine housing initiative and your work with Dunn House. Let's talk about this.
Well, I think that's the thing that we've kept hearing from community members, from people, from patients directly. We need solutions. I mean, the idea, as researchers, we're really good at putting out the numbers, at putting out how stark the situation is. But what I really hope that we can see with initiatives like Dunn House is that there are concrete solutions that are possible. Now, Dunn House is about 51 housing units that is offering high-need supports for people who are really complex medically and socially with their health status. But what I hope we can see is that we don't need, 100 more Dunn Houses. What we need to do is look at there are targeted ways that we can get out of this homelessness crisis. So there, in some cases, will be more Dunn House approaches, where for people who have very high health needs and social complex needs. But the report is also really clear: there is not enough housing supply. And one thing that we could say about solutions, I don't want to sit here and say, this is a crisis, it's a nightmare, it's only going to get worse, there's impending doom. What I think is really helpful and hopeful about this report is if we make the concerted efforts and actions now, we can actually bend that curve away from chronic homelessness.
Okay, we're 10 days into 2025. Let's talk about next week, 6 months from now, and then the end of this year. What do more tangible solutions look like?
So I think we need really immediate and these long-term solutions at play, because you're right, we're now looking at the first week of January and we are in the throes of winter. And the realities are, for a lot of people, there's not access to warming centers, there's not access to safe space, and people who do not have access to these really basic necessities in a Canadian winter are at real higher risk of things that we've talked about, amputations or other cold-related exposure and injury. So we need to ensure that everyone who needs safety right now in the winter is able to get it through more of these interim solutions. But we need to start seeing every level of government, the public and private sector, come together to make investments that we are making in other areas. There are policy initiatives that are running up, tabs of $1 billion to $2 billion. And to me, there is no other way of addressing and ending homelessness unless we're willing to make that investment and change the way we're doing this with the status quo.
And right now, we're going to take a pause in the conversation, but continue it throughout the year. Dr. Andrew Boozary, University Health Network, thanks for your time.
I really appreciate it.